Well, to answer any question around why I got involved in patient safety, I would have to go back to 1999. I discovered that my 21-year-old son died as a result of medical error. And it became increasingly more difficult with the realisation that all of the errors involved in his care were actually preventable. And I suppose there were two aspects of the whole experience which influenced, if you like, my desire or wish to be involved in patient safety. One was that every point of contact with within the Irish healthcare system failed, Kevin. And certainly that should not happen. And secondly, then, the injury was compounded by the very real fact that learning opportunities were frustrated by damage limitation efforts after his death. Things around disclosure, things around fudging, not being open, not being transparent, not being honest. And I also then came to a realisation that a significant number of preventable healthcare events do occur. So that, if you like, was the motivation. You asked me, how do I feel? Well, I attend many meetings, go to committees, and I have an expectation that when I go there, I will be treated with respect. I have an expectation that I'll be listened to. I have an expectation that my concerns will be treated seriously. And not once have I been disappointed in that expectation. Well, first and foremost, I think it's really important that for the healthcare system and the individuals involved in healthcare to operate out of a mindset that is open, that's transparent, and that the culture in the organisation would promote that. Because healthcare has to prove, if you like, that it is worthy of the trust of vulnerable patients and of concerned carers. So I think that would be the very first thing, the climate in which you're going to operate. Secondly, then, we have to put in place the recommendations of the Commission on Patient Safety and Quality Assurance, and we have to do that both in the spirit of the recommendations as well as the letter of the recommendations. And since simple measures save lives as well, it's important that we would do some work on prevention. Prevention is better than cure, and the simple measures can often turn a potentially hazardous situation, if you like, into the actual prevented becoming an actual adverse event. Leadership is key. The leaders have to show the way, but in doing that, I think they need to also ensure that what they're asking of their frontline staffs is possible. Frontline staffs are very often frustrated by being asked to do things and then they don't have the tools with which to do it. So the system has to be supportive and robust enough to provide that, put those things in place. And if you like, the frontline staff are a human resource, as are also the patients. Patients are a huge resource and a hugely untapped resource. Because when you think of it, the patient is there throughout the full continuum of care. They have information and an insight into the condition that nobody else has. So that needs to be used more. And again, coming back to the Commission, the network of patient safety champions needs to be set up because it needs to be formalised, and that network can then be a resource for healthcare. Doing the kind of work that I do, having a pool of people who can do that kind of work, because for me I would be very saddened if the baton that I'm carrying wasn't passed on to somebody else.